So for our participants, this is a perspective on recent learnings about PKU in the brain. And I'm happy to introduce Dr. Shawn Christ, who's no stranger to the world of PKU or even Canadians in PKU.
Yes, it's been a while since I've been up north. Beautiful country. Yes, I'm Shawn Christ. I'm from the University of Missouri, and honored to be here today to share some of the recent research on PK in the brain from both our lab and other labs. Joining me today is Hayley, Clocksin, and Kelly Boland, two other members of our research team in the laboratory. You know, when we do this research, there's so many components to it, and it's such a large undertaking that it really does take a team to do this. And so it seemed only kind of right and true to invite Hayley and Kelly to kind of join in on this presentation. And so Hayley's been doing quite a bit of work looking at the brain data, particularly as it relates to white matter and some of the new exciting stuff that we got going on in the lab. So I'll have her, when we get to that point in the presentation, Hayley will kind of take over and talk about some of her recent research that was actually published in Molecular Genetics and Metabolism, the journal, earlier this year. And then Kelly will later talk to us about some of the really interesting work that she's doing, looking at how anxiety can mediate the effects of PKU on cognitive performance, particularly things like working memory. So idea is that with increased anxiety, that can disrupt our ability to do different aspects of cognitive performance. So with that said, I always like to start with kind of a conceptualization of how we as our lab kind of look at PKU and study PKU. So traditionally, PKU, or PAH deficiency as it's also been termed, has been associated with a disruption in the dopamine system, right? And dopamine is a very important neurotransmitter in the brain. And so with the dysregulation of dopamine, we can see brain disruption related to that. However, the more we study PKU, the more we realize it's not this simple. It turns out that there are a number of different other ways in which PKU can disrupt the brain or lead to brain disruption. So for example, high phenylalanine in the system can compete with other large neutral amino acids to cross over into the brain. And so what we end up is that high phe will compete with other neurochemicals such as tryptophan to get in the brain. And so we end up with lower than normal levels of tryptophan, which is a precursor for serotonin, another important neurotransmitter. And so not only is dopamine affected, but we can have these other neurochemicals like serotonin affected as well. And so all these different effects lead to and contribute to this pattern of brain disruption that's kind of characteristic of PKU. And then of course, when we have brain disruption, that in turn feeds into the cognitive behavioral presentation that we can see at school, for us in the laboratory, or maybe in the clinic. So we get this profile of cognitive behavioral strengths and weaknesses that we can see in some individuals with PKU. And so today, again, I'd love, we could talk all day on most of this stuff. Because we have limited time, what we're going to do is kind of focus in on the aspects of brain disruption and also that cognitive behavioral presentation and particular aspects of that. I will note real quick is that, you know, we're going to go through this and this presentation. And when we're done, I'm happy to stick around and answer questions that I know Kelly and Hayley are as well, if people have individual questions. So if you think about the questions and want to type them into the chat, that's great. To be fair though, when I'm presenting, I have enough to kind of try and keep track of it in Zoom. To try and answering it as we go may be a challenge. But if questions come up as we're doing this, feel free to kind of put them in the chat or wait to the end, and we're happy to answer them then. So, turning our attention to that kind of profile brain disruption, what I like to do is kind of talk first about the brain in general. So the brain is a very complex organ. There are many ways to conceptualize it, to slice or dice it, as I say. But one of the major distinctions we can make is between what we call gray matter and what we call white matter. And so here on the right, what you see is what we call an axial slice of the brain. So it's kind of just right through here. Here's the top of the brain, here's the bottom of the brain. And so when we think about the gray matter, The gray matter tends to be on the surface of the brain, so it's highlighted here in red. And we can think of this as the tissue where the data processing occurs. This is where the information is crunched, if you will. That's contrasted by what we call the white matter, which here, of course, is in blue, and that's more medially or centrally located. And these represent these long distance neural fibers or wires that connect different brain areas. So this allows like the frontal cortex to talk to the posterior cortex efficiently. And so in terms of PKU, there's been some recent research, a lot of it out of our lab, showing that gray matter is affected in PKU. But with that said, it is still the case that the most salient effect of PKU, particularly high phenylalanine levels, appears to be on the white matter in the brain. And so we're going to talk about today again is recent research we've been doing in the lab that Hayley's been leading, looking at how is the white matter affected, and can we start to break that down, not just in a region of the brains, but what exactly, which fibers or which wires are affected. So I'll turn it over to Hayley. Hayley, all yours.
Awesome, thank you. So you can actually go ahead and go to the next slide for me. So we're just going to look and kind of get one more piece of anatomy in here to set us up for this discussion. So once again, on the right-hand side of the screen, we're looking at that axial slice that Dr.Christ described. The one difference here is that we're looking at a slightly different weighting, a slightly different type of imaging. And so now these darker areas towards the more inner portions of the brain, those are our white matter tracts. And those lighter portions on the outside are now the gray. So before it was the opposite, but now we're looking darker is white matter, lighter is gray matter. So I know it's a little bit confusing, but we'll switch that back soon. And then on the left-hand side of the screen, what we have is this other view where we're looking at the brain from above and also from the side. So we're trying to get this 3D effect. And then in that, we have this blue structure, which are the ventricles. The ventricles are these fluid-filled areas of the brain that produce the cerebrospinal fluid, so that acts to bathe, provide nutrients to the brain, and then also kind of act as a cushion in that regard as well. So then turning our attention back to the right-hand image in the center of the brain, you see those really bright white, almost butterfly-looking structures. Those are the ventricles as well. So you kind of can image them in this 2D version and then also this 3D version because they are these large structures. And the reason that we highlight this is because this is an area where we see a lot of disruption early on. So this image on the right-hand side, this is from an individual without PKU. You can see those white matter areas are dark, as they should be with this type of scan. If we move on to our next slide, we now look at an individual with PKU, an individual who's been treated, diagnosed since birth, so an individual with early treated PKU. And these arrows are pointing to areas near the ventricles and the white matter, where you can see that the white matter is much lighter. Remember, in this type of scan, white matter is typically that darker color. So you can see this widespread whitening going on, kind of, if you can imagine, 4 corners of the ventricles. So kind of towards the back of the ones towards the back of the brain, and then towards the front of the ones in the front of the brain. And this is this global pattern of development that we see in terms of white matter differences among individuals with PKU. Oftentimes we see initial findings towards the back of the brain, that more posterior region, and then over time, perhaps while individuals age or as Phe levels increase, it progresses forward. So we do see this global back of the brain to front of the brain progression, which has been pretty common. It's one of the original reasons why white matter was investigated, because these findings are really easy to see. The brain on the right-hand side of the screen hasn't gone through any special processing. Pretty much to the naked eye, you can see that something different is going on. And that's helpful, but it is limited in that, we can look at this and we can potentially judge, how disrupted or what might be going on. But ideally, we'd actually be able to measure those differences and be able to provide some sort of quantitative value to what's going on. And so that's where a lot of this research has moved into a type of scanning where we can actually put measures on this and actually know and measure white matter integrity in a much finer way. So moving forward, we have an example of one of those studies. So in this, just to orient you guys to these pictures, these first 5 images are, again, those axial slices. So the areas towards the top of the slide are corresponding to the front of the brain. Towards the bottom of the slide, we're looking at the back of the brain. And then all of these lines that are inside of those images that in the various colors, those are individual white matter tracts. So when we're looking at these images structurally, kind of turning your attention back to what we just looked at, it kind of seems as though white matter is one mass, it's one single entity. When in reality, it's actually made up of all of these individual tracks that each serve different functions, that are very similar to one another, but do have their distinct, these distinct entities and properties as well. And as I mentioned earlier, this type of scanning allows us to actually look at these white matter tracks and measure their integrity on kind of the microscopic level. And so here, what we're looking at is these tracks that are in these warmer colors, the yellows, oranges, and reds. These are white matter tracks that have reduced white matter integrity, greater disruption in individuals with PKU relative to individuals without PKU. And then looking at those green tracks, those are ones where there's no differences between individuals with and without PKU. And there's two major takeaways with this. The first one being is that we see that there's a lot more going on than what meets the naked eye. When we were looking at those images before, we could definitely see that there are some differences or some abnormalities near the ventricles, which we do see that here as well. But we also see that there's a lot more widespread differences throughout the brain that we couldn't see just by visual inspection alone. So that means that there is a lot more going on that maybe we couldn't see before, but at the same time, we are still seeing the same or very similar progression. Original differences popping up towards the back of the brain and progressing forward, or more severe differences towards the back of the brain and then going forward. And so with this does add another piece to the puzzle, but the next question becomes, well, what's going on the individual tract level? Here we're looking sort of as tracks as a whole, but yeah, we want to look forward and see what's going on along individual tracks themselves. And so that's where a lot of my research has come in this case. So rather than looking at all the tracks, we decided just to pull one forward for you guys. So we're going to really focus in on one, but this one really exemplifies the patterns that we found. So for the sake of time, we're going to focus on the left superior longitudinal fasciculus. Moving forward, I'm going to call it the left SLF. It's a little bit less of a mouthful for me and a little bit easier to remember for everybody else. So on the left-hand side of this screen, we have this cartoon image of a brain. Again, we're looking at it from the side. So you can imagine the sagittal slice this way. The front of the brain is to the left, the back of the brain is to the right. And then that image in red, that is our cartoon version of the SLF. So you can imagine that's what it's looking like inside of the brain. And then orienting you all to the graph on the right-hand side, on our x-axis, that horizontal axis, we have location along the tract, or location in the brain. The left-hand side of the graph is corresponding to the front of the brain. The right-hand side is corresponding to the back of the brain. So these images could almost be overlaid on top of one another, and you would see the same thing. In terms of our vertical axis, our y-axis, we're looking at white matter integrity. Higher is higher on the graph, lower is lower on the graph. And for our purposes today, generally higher is better, higher is more ideal. And our first line here, we have our individuals without PKU. You can see that they're relatively steady across the tract with a slight dip upward towards the end, but relatively consistent. Then when we place our individuals with PKU on, again, we see two major patterns here. That's very much mirroring what we see in the brain globally. So they're in this yellowy gold color, and we can see the first major takeaway is that individuals with early treated PKU have lower white matter integrity overall. That line is under that of individuals without the whole way across. The second major takeaway is that right-hand side, when we're moving more towards the back of the brain, we see that those differences get larger. The part of the tract towards the back, or the rear portion of that tract, is showing a greater difference or greater abnormality or disruption relative to individuals without PKU. So again, we're mirroring this global effect we see in the brain on the individual tract level as well. And then when we think about this, we can think about why this might be happening or what might be driving this. And to do that, we can take those individuals with PKU and split them up by their Phe levels, because perhaps Phe levels and differential Phe levels or exposure over the lifespan can potentially be driving this effect. So what we did is we took those individuals, we split them up by having relatively high Phe levels or relatively low Phe levels to see how that would look in terms of the tract itself, which is what we see here. So again, we're looking at our same tract, graph is the same, the brain on the left-hand side is the same, but we're just adding on and splitting that original line into two. So again, our black line is showing our individuals without PKU. That goldy yellow line is now showing our individuals with PKU that have relatively low Phe levels. And then that lower line in that light gray color is showing individuals with PKU who have relatively higher Phe levels. And again, we're seeing the same two major points carrying forward. In both cases, individuals with PKU are showing that lower white matter integrity relative to individuals without. And we are seeing that greater difference towards the back of the brain, those more posterior aspects of the fibers. But the interesting thing here is now when we add this Phe level analysis on as well, we can see that our individuals with PKU who have relatively lower Phe levels are almost identical. Those lines are overlapping towards the front of the brain. There's really no differences in terms of white matter integrity. But we are starting to see those differences emerge about halfway down the tract and then emerge much more obviously and more drastically as we move towards the back of the brain. And then similarly, our individuals with relatively higher Phe levels are showing that similar pattern. They're closer to our individuals without PKU towards the front of the brain, and then those disruptions become larger and more apparent as we move backward. So we are seeing this very similar progression going on. And so this portion of the study, it's showing us that higher Phe levels are more challenging or create additional issues here. But what happens in terms of lower Phe levels? Can these disruptions or these injuries, can they be reversed? And it's a really cool idea. I wish I could take credit for it, but it has been done structurally before. So this next slide, we have one of those structural scans. So I want to we're going to go away from diffusion imaging. That's what we've been talking about. We're going to return briefly to our structural imaging that we talked about at the very beginning. So on the left-hand side of the screen, we have, again, same axial slices we've been talking about before. Top of the screen is the front of the brain. Bottom of the screen is the back of the brain. And I know it's a little bit fuzzy, but again, we're looking at one of these images where these darker areas are corresponding to white matter, and these lighter areas are corresponding to gray matter. And that X shape in the center would be this individual's ventricles. And you can see those arrows on the left-hand side are pointing to these areas of white matter that would typically be dark, but they're very white. It almost looks like there's cotton balls sitting right at the ends of the ventricles. So this person has PKU. They came in, had this initial image, and then were sent home to do 3 months of a very strict low-Phe diet. Then they came back after that 3-month period and were re-imaged. So this image on the right-hand side is actually the same individual as on the left, roughly the same area of the brain. Those arrows are pointing to the same areas, and you can see that those abnormalities aren't gone completely, but they are drastically improved. You can see much darker white matter in that area. Those initial cotton balls I said maybe are now shrinking down a little bit. So this shows us that reducing Phe levels can change white matter on a visual scale. We can see these changes happening. But now our question becomes, can that be done on that smaller level, that quantitative level as well?
Hayley, can I jump in real quick?
Absolutely.
So, sorry, I'm actually, since I'm not presenting, I got to watch chat. There's a really good question, and kind of going back to this was the question is, what do we mean by high and low Phe levels? And just to give folks some reference points here, because I pulled it up while I saw it. So that's, again, the great thing that you were presenting and I wasn't. So the average age here is 20 years old. So that gives people an idea. And the high and low Phe groups, the low Phe group is running on average about 400s. And the high Phe group here is about 900. So you could see a big difference here. So, but it was a great question. So I apologize for interrupting, but that's one of those timely questions.
No, definitely. It's a good one to get right now because that's where we're at.
Yeah. So.
No worries. But yeah, so we're talking about, if we can reduce Phe levels via diet, what can happen if we reduce Phe levels and then look at these white matter tracts at this level, use the same type of analysis in this case. So that's what we did. So here again, we're bringing back that left SLF, we're bringing back those same slide orientations. And what we have on the graph right now is our original data. So we have the black line, the individuals without PKU, and then that gray line is our individuals with PKU when we first scanned them. So it's the same data as before, just bringing it back, and we're going to add one more layer. So after these individuals were imaged, they then went home and attempted to reduce their Phe levels. And then individuals who were successfully able to reduce their Phe levels by 20% over 6 months were then brought back and re-imaged. So we had that significant Phe reduction going on, and then we re-imaged them and we did the same analysis. And so in this,
Well, I was just going to clarify that the Phe reduction was related to Kuvan.
yes, treatment with Kuvan. Yeah, so then these same individuals come back and we re-image them, and they're in this bold yellow line as well. So again, a couple main takeaways. I'm going to sound like I'm a broken record because we keep seeing the same things. But we see that as these individuals reduce their Phe levels, their white matter integrity is increasing across the tract. We're seeing this main effect in that white matter integrity is improving. And while this graph isn't necessarily perfect, we are seeing a bit more improvement towards the back of the brain relative to the front of the brain. There's a bit of that uptick, a bit more of a discrepancy on those, maybe the last half. So this is suggesting that just as the brain globally experiences injury from a posterior to anterior or back to front manner, we're seeing similar patterns in these individual tracts. But the method of recovery or these improvements also kind of progresses in the same way. So we are just kind of reinforces this idea that back of the brain to front of the brain, this posterior to anterior progression is relevant and important. And this is all well and good. You know, we're able to look at the brain and see what's happening. We're able to measure the brain and see what's happening. But the next question becomes, you know, what does this mean, or why does this matter? And the way that I kind of think about that and the way that we're moving forward in the lab is saying, okay, we have these measures and this ability to measure white matter integrity at multiple points along the tract. We know that these white matter tracts are important for a variety of cognitive functions. Can we find relationships between white matter integrity along the tracts and performance on cognitive measures? So unfortunately, this is still in progress. We don't have those results yet, but we can kind of talk about what we might expect. So going back to our friend left SLF, we know that it is important, especially on the left-hand side, for language. We know it's important for attention, and then something called inhibitory control. Inhibitory control is a fancy way of saying, you know, kind of preventing a primed response or a response that's easier to make. Kind of the classic example I think a lot of people know of right now that is imperfect but will work for our purposes is the marshmallow test with kiddos. That sort of thing. We have much fancier ways of measuring it in the lab, but just to kind of give you a rough idea of what we're talking about. And so what we might expect is that individuals who have lower white matter integrity in a tract such as this, they might show differences in their ability to you know, find language, attention concerns with inhibitory control. So that's really where we're moving next in terms of finding out if there's these relationships between white matter integrity and these various cognitive functions. And then we'll do this again, not just with the left SLF, but with many tracts throughout the brain. Again, the software that we use allows us to parse out 20 different tracts. Again, just for brevity, we're only going over one right now. But yeah, so we're seeing, you know, this is a lot of stuff about white matter. We're definitely talking about white matter, but moving forward, you know, Dr.Christ hinted that gray matter is important as well. So we can go ahead and go to the next slide for me, and then one more. But yeah, so white matter, as we've discussed already, it's easy to see. It was some of the initial findings. So lots of people look at it because we know that there's something going on and that white matter differences are important among individuals with PKU. But again, we're now recognizing that gray matter differences might be relevant as well. And so we do have one example here to show you. So on this next slide, so what we're doing is we're looking at that sagittal slice. We flipped the brain on you a little bit. So now the front of the brain is to the right and the back of the brain is to the left. And highlighted in red, we have the cerebellum, affectionately known as the little brain. And that's because it just kind of sits below the main cortex, and it's organized very similarly to main cortex as well. So we have gray matter on the outside, we have white matter tracts on the inside. And what we can do is we can measure the volume of white matter and gray matter in the cerebellum. And what we see here is when we look at the white matter, we don't see any differences between individuals with and without PKU. In contrast, when we look at the percent volume of gray matter, we do see this difference emerge where individuals with PKU show less gray matter volume than individuals without PKU. And when we think about the behavioral or cognitive presentation of many individuals with PKU, this does make sense. Some people report having tremors or difficulty with fine motor control, those very fine hand movements that require a lot of dexterity. Sometimes those can be more challenging. And since the cerebellum, one of its primary roles is incorporating motor movements or motor skills, it would make sense that perhaps we would see differences in this area as well. So again, very brief snapshot of what's going on in gray matter, but this is something that our lab is working on, and we should have more for future talks. And so with that, I will turn it back over to Dr. Christ.
Great, well, thank you, Hayley. So again, that's just a quick overview of some of the recent stuff that we've got going on. We're hoping actually to come out with even more stuff this summer. That we're happy to come back, maybe if we get an opportunity and share with you more. And part of that, part of what we're working on too is looking about how these differences in the brain relate to day-to-day function. Because again, we talk about the brain disruption, and that feeds into what we see in the cognitive behavioral presentation. And so kind of turning our attention, oops, let me click here, to that. What we know overall from not just our lab, but all the research kind of cumulatively, is that individuals with early treated PKU are at risk for relative weaknesses in certain areas. And so again, this doesn't mean that everybody with early treated PKU is going to experience these things. It just means that that individuals with early treated PKU are at risk for these, and that risk is higher as Phe levels are higher. And so that profile that we're talking about includes a slight decrease in overall IQ, coupled with difficulties with executive dysfunction. And so executive function represents these higher order abilities. So things like strategy use, planning, organization, those higher order abilities. So individuals can experience difficulties with those. Also, they can experience difficulties with processing speed. And so this is simply the speed with which information is processed. From a theoretical standpoint, we kind of link this up with the white matter disruptions that Hayley was talking about, because those white matter pathways are really what allow different parts of the brain to communicate with each other. So if we interrupt those or disrupt those, we disrupt the speed at which we can process information. Also, we're learning more about difficulties with motor control, particularly fine motor control and learning. Again, from a theoretical standpoint, we could potentially link these back to the differences in the cerebellum that Hayley just mentioned, because we know the cerebellum is very important for motor control and coordination. Another thing which we've known for a while, but really hasn't, in my opinion, received as much focus and emphasis as it maybe should, is the fact that individuals with early treated PKU can be at increased risk for experiencing anxiety and depression. And so this is one of the things that our lab has turned its attention to most recently. We're actually going to, here in a moment, turn it over to Kelly so she can tell you about the exciting study we're actually conducting right now looking at this. So let me see if I can click this over. All right, Kelly, it's all yours.
Awesome, thanks. So yeah, to start off, I thought I'd talk a little bit about kind of the theories behind why we see a higher mental health risk in people with PKU. So starting off, first I want to talk about this biological explanation. And so we've seen this before. Dr. Chris had kind of talked through how PAH deficiency or PKU can cause disruptions in dopamine. Dopamine is a really important neurotransmitter or neurochemical in the brain that has effects on things like motor control, mood, and behavior. And so we have a lot of this brain disruption going on. But as he mentioned before, there's also other pathways by which PAH deficiency can lead to brain disruption. And one of those is through disruption of our serotonin system. And more specifically, we end up with less serotonin in the brains of people with PKU. So on the next slide, I try to describe why that is that we see less dopamine and less serotonin in the brain when Phe levels are running high. So this graphic is showing the blood-brain barrier. The blood-brain barrier is this barrier surrounding our brains that allows certain chemicals to come into the brain and keeps other chemicals out. So throughout the blood-brain barrier, there are these different channels. So for our purposes, we're going to talk about the LAT1 channel, and you can think of it as a gate. So it's allowing certain chemicals in, keeping other ones out. And the LAT1 channel is important for us because that's what allows large neutral amino acids in or out. So that includes things like phenylalanine, tyrosine, and tryptophan. So when you have high Phe levels in your bloodstream, when it reaches the blood-brain barrier, what happens is that a phenylalanine molecule, because there's so many of them, are going to be much more likely to hit that LAT1 channel and be brought across into the brain than, say, one of those other molecules like tryptophan, just because of the sheer number of phenylalanine molecules that you have relative to those other molecules. But not only that, but your LAT1 transporter actually prefers phenylalanine over tryptophan and those other molecules. And so if the LAT1 had to choose between a Phe molecule and a tryptophan molecule, it would also choose a Phe one. And so what you end up with then in the brain is more phenylalanine, and phenylalanine turns into dopamine. It becomes metabolizes into dopamine. And so in PKU, we have that disruption in that conversion from phenylalanine into dopamine. So if you click ahead a little bit, Dr.Christ, you end up with less dopamine in the brain. And then now we're getting tryptophan. So tryptophan metabolizes into serotonin in the brain. But when you're getting less tryptophan into the brain, you're also getting less serotonin. And what we found is in other research studies, people have found that in mouse models of PKU, so basically where they kind of recreate the idea of PKU in mice, when they look at the brains of those mice post-mortem, they do find that there is less dopamine and less serotonin. So there is quite a bit of evidence to support this kind of theory for why phenylalanine would later lead to these dysregulated neurotransmitters in the brain. And so on the next slide, we're going to talk a little bit about a second hypothesis going on called the psychosocial burden hypothesis. So this one, instead of being more biological based, it's more kind of environment, behavior based. And so this hypothesis has been explored in a lot of different chronic illnesses, including diabetes. And what it says is that there are so many demands on patients with chronic illnesses that can lead to increased stress and increased mental health problems. And so just to name a few of the demands on patients with PKU, people with PKU have to closely adhere to their diet, especially for youth. That's something that, they're trying to gain more independence from their parents, but the parent might have to become more involved to make sure that those Phe levels are running in a healthy range. People with PKU can also end up feeling like the odd one out, especially when trying to just do normal, things with friends and family, like going to restaurants, but maybe not being able to find appropriate food to power them through the day. There also can be guilt and anger at having PKU and all the associated medical care that goes along with it. And as Hayley and Dr.Christ have mentioned, you also get, when you have high Phe levels, an increase of physical symptoms like kind of hand tremors and fatigue. And we know that fatigue in particular is a core symptom of depression. So if you're feeling fatigued, that can end up leading to more feelings of depression. And so clicking ahead, the result is that you have increased medical care fatigue and burnout because of all these environmental factors of caring for PKU. And this kind of acts kind of in a cyclic fashion within the biological hypothesis, because as you're feeling more burned out, you might feel less likely to want to stick to that Phe restricted diet. And so now your Phe levels are increasing even more. You're getting more dysregulated neurotransmitters, which is also having negative effects on your mood. So you can see it just kind of cycles over and over again. And so looking at the research into mental health in PKU, as Dr. Christ was saying, this hasn't been explored as much as some of those cognitive problems, but there is quite a bit of research out there that does point to this relationship. And so this graph is taken from one study that they had given a screener for psychological distress to a bunch of different clinics that saw PKU patients. And so for people who have a positive screen on that screener, that means that you have clinically significant levels of distress. And so they found that 1/3 of patients with PKU were reporting psychological distress. But more interestingly, if you broke that down by age group, really where you were seeing the most distress was in adults. And so you can see here in this graphic on the x-axis, those three purple uh, rectangles, if you will. The younger individuals, about 20% are reporting psychological distress. For adolescents and teenagers, only about 15%. And then you see that biggest jump for the adults with PKU. Over half of people with PKU in this study were reporting a positive screen, reporting clinically significant levels of psychological distress. And so when we compare that then to the general population, we see that for youth, it's about on par with peers. So we expect about 13% of youth will have a positive screen, which is exactly what we see there. But for adults with PKU, or forgive me, for adults without PKU, we only expect about 10% of people to have a positive screen. But this study found that 55% of adults with PKU were having a positive screen. So this kind of suggests to me that as people get older, especially those kind of young adult college years, people tend to fall even more off diet. And so that's when you start to see those higher Phe levels, higher dysregulation there, and that is going to contribute more to the mental health problems. And so, we've been using this term psychological distress, but I think it's important to kind of break that down into specific types of mental health problems. And so on this next slide, there was a study that did just that. So they looked at specific types of mental health disorders or concerns. And what really emerged for this PKU group as being heightened was anxiety and depression. So in this light purple, you can see those are individuals with PKU. The darker purple is people without PKU. And really across the board, there are a higher number of people reporting depression, anxiety, phobia symptoms than people without PKU. And so as I had previously mentioned, we think a good deal of this has to do with high Phe levels contributing to anxiety symptoms and depression symptoms. And so there was this really cool study that I'll mention briefly, that what they did was they took a group of people with PKU and they gave them one of two pills. One of the pills was a placebo, or just kind of like a fake sugar pill. And one of them was a Phe supplement. And so it was actually increasing people's Phe levels over those 4 weeks. And people didn't know which one that they were being given. At the end of those 4 weeks, what they found was that the people who had been given that Phe supplement, so who now with PKU, their Phe levels were running higher than this placebo group, the Phe supplement group was reporting increased mental health concerns. And when you asked somebody who was close to that participant, hey, have you noticed any differences in the mood of this individual? For that Phe supplement group, people were saying, yes, I've noticed more irritability, I've noticed more anxiety symptoms. And so it wasn't just something that the people with PKU felt internally, it was enough that actually externally they were showing more mental health concerns. And so similarly, there have been quite a few other studies that have found this relationship. So people with higher Phe levels tend to experience greater rates of anxiety, more thinking problems, and an increased risk of depression symptoms. So this has raised a very interesting question for me, because we, as previously mentioned, we know that Phe levels are related to cognitive abilities. And so clicking ahead, so, in the literature, it's well established, the higher your Phe level is, the more difficult it is to do things such as working memory tasks. And so working memory is is basically the ability to keep information in mind in the short term and to manipulate that information in your head. So you might be doing like calculations on that information or things like that. But we also know that high phi is related to increased anxiety. And so the kind of missing puzzle piece here is that anxiety is also related to cognitive performance. And so even in people without PKU, you tend to see that higher anxiety is related to worse cognitive performance. And so for this next slide, you can see kind of an explanation of why anxiety and cognition, why those two things are related. And so first, in the brain, we have a limited number of resources that we can give for different cognitive abilities, like I had mentioned, like working memory or attention. And so for people who are experiencing anxiety, the theory, or one of the theories, is that those worries that you're having are using up some of those limited resources. So there's less resources available for working on, thinking activities, for, paying attention to something that's important for your job or for school. And then there's also this second thing going on specifically with attention, the second process going on. And so we have two processes in our brain that help us decide where we're going to put our attention. The first is called top-down processing. So that's the idea that a thought that you have is going to cause you to focus your senses on one particular thing. And so, for example, if you were taking a test, you might have the thought or the goal that I want to do really well on this test. This is where I want to pay attention to. And so that thought, that goal of doing well on your test is going to be what causes you to focus your eyes on the computer screen as you're taking the test. It's going to be what's focusing your hands on the keyboard, what's kind of tuning out sounds around you, just focusing in. But there's also this other process that goes on at the exact same time that's called bottom-up processing. And that is the opposite, where actually your senses or sensory stimuli in your environment is going to dictate where that attention goes. And so in my example I was giving of focusing on a test, bottom-up processing might occur if there was all of a sudden like a loud crash in the room. So your sense of hearing this loud crash is going to be what ends up pulling your attention away from your test and over to what that could have been. And so as you might imagine, for people with anxiety, you tend to default more to this bottom-up processing. And this is the idea that people with anxiety are constantly on alert for danger in their environment. So it's actually beneficial if there is danger in your environment to be in tuned with sounds, sights, smells, things going on around you to pull your attention. But if there's not as much danger going around, it can be really disadvantageous to have this bottom-up processing taking control, because even though you have the goal of doing well on the test, something else keeps pulling your attention and pulling you away. So clicking ahead to this next slide, we are currently doing research that explores these three things: phi levels, working memory, and anxiety. For this particular graph, we haven't looked yet at phi, but we're just looking at working memory and anxiety in people with PKU. So this was a study where we had people come into the lab. We gave them a bunch of different thinking activities, one of which was a working memory task. So again, a type of activity that has people keep information in their mind and try to manipulate that information. And then on this x-axis on the bottom there, that 0 to 35, that represents people's anxiety scores on the Beck Anxiety Inventory. So a higher score means higher anxiety. On that y-axis with working memory performance, higher scores mean you performed better. And so we found exactly what we would predict that we would find. We found that people who were reporting higher anxiety levels performed worse on the working memory task than people with lower anxiety scores who are performing much better. And so kind of our next step is we're going to explore this in future studies with also throwing in how Phe level might influence that. So again, we'd expect Phe level to influence anxiety and Phe level to influence working memory. So in a sense, it might be kind of a double whammy to have both of those working against you. And now I will turn it over to Dr. Christ.
All right. Well, thank you, Kelly. We're almost out of time today. And so we'll just take a minute to kind of summarize, again, what we're finding in our research, both, of course, what Hayley and Kelly's presented, but also more generally, is in short, what we know is that individuals with early treated PKU are at increased risk for developing certain significant neurological, cognitive, and psychological difficulties. However, all the research points to the fact that the degree of risk is moderated by treatment to lower blood Phe levels. So the lower we can keep our blood Phe levels, the more stable we can keep them, the lower this risk appears to be. In addition, much of the data points to these effects on the brain and behavior being reversible, at least to some extent. So we're not going to say they're completely reversible, but again, things can get better with lowering Phe. So with that, and that's for all ages. So, you know, some of the data, like we said, that Hayley showed earlier, those weren't child brains, those were adult brains that were showing improvements in white matter with lowering Phe levels. The older studies from Cleary et al. From 1995, those old brain images she showed, again, those were adults. And so it's not just kids, it's also adults. It's never too late to lower Phe levels to positively affect these consequences. So that's kind of our take-home message. Looking forward, what are we doing? Again, one of the things that we're doing in our lab, and I think as a field, is really trying to pull these different aspects of research together. So, you know, we've studied Phe levels as they relate to the brain. We've studied cognitive outcome. We're studying emotional outcome now. But the real question is, how do they all intertwine? So how do Phe levels affect the brain, and how does that relationship feed over and directly affect day-to-day life? And so that's, again, what we're focusing on in our lab, and I think others are too. In addition, one of the most common or frequent questions I get whenever I engage in discussions with individuals is, what does it mean to get old with PKU? Are there, as you grow older with PKU, you know, do those individuals with PKU, are they at increased risk for developing different neurological conditions? At this point, we don't know. And so again, when we started this research, or when I started it a long time ago, you know, we really focused on kids, and the more we research, the more we're getting into adults and older. And we'd love to do something looking at actually not older adults, but let's say middle-aged adults with PKU to see, you know, really what does it mean to grow older with PKU in terms of the brain and cognitive performance. So that's all we have. Oh, sorry, I forget to say thank you. Big thank you. I mentioned earlier, this, you know, our research in our lab, like many labs, it's a team effort. And so we couldn't do it with one or two individuals. It really takes a large team. And so we really thank everybody that's a part of our lab here at University of Missouri. This last year has been very challenging because we've been working remotely, but thankfully we're starting to get back to in-person next week. And also thank you to our past funders and sponsors, which have included NPKUA and Biol. So again, I'm happy to open it up to questions now, but if something comes to mind later, feel free to email me, chrissc@missouri.edu, or you can Google Christ and Missouri, and I'm pretty much, I think, the only person to come up. So, thank you. So, John.
Yes, I see that there is a question in Q&A. I'll just read it out for everybody. From Francis, should someone with PKU, also diagnosed with ADD, attention deficit disorder, focus more on lowering Phe than taking ADD medication? For example, the drug known as Concerta. Right? Anybody want to take a stab at that?
So I will take a stab at that, but I have to condition it to say that I'm in the US, only medical doctors can prescribe medication. And so I do not have prescribing privileges. So just keep that as a nuance. In my experience, what I've seen and what I would suggest is that it can be difficult. Higher phenylalanine levels, even in somebody without ADHD, is associated with problems with sustaining attention. And so if you have high Phe levels in somebody with ADD, the challenge is both of those can be contributing to the problems with attention. And we don't know which is which. And so my suggestion also always is, let's see about lowering the Phe levels if that's reasonable to do, and see if your attentional difficulties go away. They very may well not, but that may make it more manageable, that then you can treat it with Concerta or another stimulant or whatever your medical provider decides with you in consultation would work. But what we do know is that the attentional difficulties related to phenylalanine don't seem to be helped by something like Concerta. Concerta is going to help with the ADHD part, but not the attentional difficulties related to Phe. And so again, my suggestion would be if you can lower the Phes in an effective manner, and sometimes it's difficult, I mean, it's real life. If you're able to do that and see if that helps with attention, if it doesn't get rid of all of your attentional difficulties, then maybe turning to pharmacological treatment for ADHD would be the way to go. So I hope that helps.
If indulge me, as a co-host, I get to ask a question. So a little introduction. In recent days, both the American College of Medical Genetics and the professional group in Canada for metabolic clinics and clinicians called the Garrett Association have separately announced initiatives to form committees to take fresh look at PKU clinical practice guidelines. In Canada, we've never had published clinical practice guidelines for PKU. The American College was the first to do them in recent years, and followed by a consensus group of professionals in Europe, followed by the clinical specialists in Australia. They've all produced their versions of clinical practice guidelines. Given that the American group and Canadian group have announced their intentions to do this, these findings about PKU in the brain speculate a little bit about to what extent they can and should be built in or taken into account as these professional groups are looking at what best practice how it's evolving in terms of clinical practice for PKU.
Wow,
Care to make any comments about that? And
Sure.
To what extent are you guys involved?
So I've not been invited to that party. I think there are really two points or focuses that I think are important to keep in mind. One is, we talk about ranges, and the original guidelines say, well, if you're in this range, if you have your Phe levels in this range, that's safe or that's acceptable. And I think by doing that, there's a nuance that suggests that, so let's say 2 to 6 or what is that, 120 to 360, is considered treatment range. And there are some people that have misread that to say oh, well, then if I keep a 300, my brain's not affected. And what I would say is that that's not the case. All the data we have on the brain suggests that it's a linear relationship. So it's definitely true that somebody that runs 300s is less affected in terms of brains than somebody that runs 500s. But that doesn't mean that there's not some effects of running 300s on the brain. And so I think keeping that in mind, that it is a linear relationship on Phe levels, and not just, hey, if I can get below 360, the brain's not affected at all, is important. So I would say that. The other thing I would say is that the brain data and the cognitive data all support the idea of diet for life. And the fact that high Phe levels are not only detrimental during childhood, but they're also detrimental during adulthood. And I've read some things recently where people were advocating that, oh, well, high levels and any brain damage associated with high Phe levels in adulthood is completely reversible. And that's completely not supported. There's actually reasons to believe that, yes, if you have high Phe levels in adulthood, the brain damage or the effects on cognition may be more reversible than during childhood, but there's no evidence to believe that they're fully reversible. And so with that, again, just keeping in mind that diet for life is very important. So John, those will be the two things that if you get in those meetings and I don't, please advocate for those two things.
Okay, well, yeah, you will have a close ally because Christine Brown is a full member of the new ACMG committee. So and you know who Christine Brown is. So
absolutely.
We have a fresh question in Q&A again from Francis. I'll just read it out. How do we help 17-year-olds to want to continue to stay on low protein diet, especially if they're already in a downward cycle of anxiety, depression, and cognitive performance? So that's a practical, how do we help folks like that question?
And I think that question could probably be extended to any of the adults who are trying to walk away from diet.
Yeah, and it's a tough, it is definitely a tough one because we talk about it getting into a tough cycle, right? So if we say that high phenylalanine affects things like, increases anxiety, leads to problems with strategy use and planning an organization, and then you're asking those young adults to also be responsible for maintaining their diet and their Phe levels, it's just a vicious cycle, right? So if you have problems with strategy use, planning, organization, or let's say you're agoraphobic, you're anxious about going out, interacting with people, that is detrimental for trying to maintain a good diet and low Phe levels. And in terms of breaking that cycle, I think it's a challenge. I've been talking recently, I have a colleague that does fascinating research on medical decision-making. And I've been, one of the things on my to-do list is really to get her involved with some of the stuff we're doing with PKU. And what's interesting, what she does is see what some of the decision-making and where are there places that to potentially step in and support individuals. I don't say to make the right choice, but we know what we're talking about here, to support them in either continuing or restarting diet. It's going to take work and it's going to take support is the best, but it's a great question and I say a great problem, but it's an ongoing issue that we have on the field.
Yeah, I also wanted to jump in, Dr.Christ, on that, just from like a structural point of view, like if it's possible for clinics to get a psychologist or a counselor involved in their clinic, how beneficial that can be. I'm in a clinical psychology PhD program right now, and so I've had the good fortune of getting to work with a couple patients with PKU on just this exact thing of, school is overwhelming already, and now we have these extra issues with medical management on top of it. And so just what we were talking about with the medical burnout, how do you help mitigate burnout related to these things and still stay healthy? And so I think, if I can make a plug, I don't know if that's part of the talking about clinical guidelines, if that's part of the discussion at all, but I would really encourage like getting some sort of connection with a psychologist or a counselor, just someone who's informed about PKU and is also informed about how mental health can play into being able to stick to one's diet over a long period of time.
And you have, Shawn, you have emphasized the brain evidence and cognitive evidence reason to stick with diet for life. Do you have any comment about therapy for life as distinct from diet for life, as there are, as you know, there are in the US, but not yet in Canada, there are 2 prescription drugs that are approved for the treatment of PKU, or as part of the treatment of PKU. And we do know that there are a number of other potential drugs in the pipeline at various stages of research and development. How do you see that adding to or complexifying the therapeutic picture?
So I'd start off, but before I answer, John, saying that BioMarin, who is the producer of both Kuvan and Palynziq, has funded some of our past research in our lab. And so just to kind of put that conflict of interest out there. With that said, you know, I talk about diet, I guess, when diet was the only thing we had. And so when you hear, I apologize to everybody, let me go back to the last hour when I'm talking. When I talk about diet, what I'm talking about is any kind of intervention or therapy that we can use to reduce Phe levels. So is that fair enough? Is that, yes, I think that these are good. I think from what I understand with BH4 or Kuvan, that was actually used quite a bit to treat BH4 deficiency before it was used to treat PKU, classic PKU. And so we have some data already on the long-term outcomes on that, and it seems very positive. Palynziq is a new game. It's a new treatment, it's new therapy. And I would have to defer to somebody like a Carrie Harding or another expert on the pharmacology of that to know about long-term outcomes. But again, when I say diet, I mean anything we can do to keep Phe levels low for life.
Okay, we've got a couple of more points being made in the Q&A, and I'll just, from Jeremy, I'll just read out his question. Is there enough evidence proving that low Phe levels can prevent any permanent or irreversible brain damage, or does it only reduce the risks and or the severity of it? Who'd like to take a shot at that?
I would say that we don't have the evidence to say that there's absolutely no damage. And that's a challenge of, it's so hard to maintain those low Phe levels, like really low Phe levels through adulthood and through childhood, that the sample of people that are able to actually hold them super low is so small that the data is just not out there. Again, what we can tell is that lower Phe levels are associated with decreased risk. Talking about the white matter data that Hayley presented, we know that the severity of that is very strongly correlated with Phe levels. So yeah, no, I mean, the short answer is we don't know for sure. The reality is in somebody without PKU, Phe levels are typically below 100. And so again, if we go back to what we consider reasonable treatment range, that's 120 to 360. 360 is still 3 times higher than the typical level of Phe. And so, I hope that answers the question. The short answer is no, we don't know yet.
So that's a pitch, Shawn, I am interpreting as we actually need to have more research and deeper science. And to do that research, we need people to volunteer in studies. So so please think about that, folks, going forward as there will be future opportunities to participate in research on PKU of the brain. So that's my editorial comment. There's a follow-up question from Francis about the previous answer. Great advice to see a counselor, but particular teenager may be adamant that they don't need help. It seems to me, this is Francis, like it might be seen similar to an addict who denies they have a problem. We can't help until they choose help for themselves. Anybody care to weigh in on that one?
I would say, well, first, I'd be careful to compare it to addiction, because I think the distinction is with addiction, you're getting some sort of positive reinforcement by using a substance, versus this is more that idea that I had been talking about like it just becomes too much. And especially for a 17-year-old who wants to be gaining more independence, doing their own thing, it's a lot, and it leads to burnout. And so it's more that trying to keep up with everything is too cumbersome for them. And so I think it is very distinctive from that of like addiction, for example. I would say with the counseling, yeah, it's hard to get teenagers in the door, or even to talk to somebody if they don't want to be there. I know, like, as a psychologist in training myself, we use this term of like getting our foot in the door by finding something to connect with the teen about. And so I know, for example, I worked with a teenager with diabetes, and kind of similar to PKU with diabetes, they were having trouble regulating their blood sugars. Their blood sugars were running really high, and they were just sick of taking their medicine. So kind of a similar idea to this with PKU. And one of the ways that we were able to work together was that we found this connection that they really wanted to participate in sports in high school. And they couldn't with high blood sugars because they were just feeling so bad all the time. And so you could think of that too with Phe levels, that, maybe for this teenager, if his levels are running really high, he might be noticing that he's having, trouble keeping up with sports. Or he might not know that there is that relationship between Phe levels and feeling more depressed. And so I think just trying to find, like, what is his goal? Is his goal to spend more time with friends and not worry as much about PKU? Well, there's ways that maybe we could help regulate your levels ever so slightly so that you don't feel as sad anymore. And if you're feeling less sad, you are going to spend more time with your friends. So I would say, yeah, for that individual, if you can kind of get their foot in the door with something, that often that could be maybe the starting point by which then they might, start finding more and more motivations to keep up with diet.
Allow me to share something that I learned from a psychologist by the name of Kendra Bajorikar. Kendra has done a lot of psychological assessments of people with PKU in Denver and in Minneapolis. She describes herself as a neuropsychologist, not a psychologist, who specializes in metabolics. There aren't too many psychologists who are neuropsychologists who specialize in metabolics. And she says there's something really tricky, even devious, about elevated levels of phenylalanine affecting a particular small part of the brain that actually tricks people with higher Phe levels into thinking they're okay when they're not okay. Now, off the top of my head, I cannot remember the name of that part of the brain that Kendra has identified as being the point where the Phe fools the person into thinking they're okay when they're not so okay. Would anybody care to comment on that?
I haven't seen Kendra talk on this. I can't think of a part of the brain that would be that localized to, but it is general in case of this idea that the more affected you are, the less aware of that being affected that folks are. The anecdotal reports that we've come across from individuals that have lowered their Phe via, for example, something like Palynziq, they come back and they say, oh my gosh, I didn't realize how much I had been affected. Like, people were telling me this, that I was affected, but I didn't realize it until I actually got my Phe levels down. And then I thought about, how often I lost my car keys before, or how distracted I was at work. So, for me, it's the anecdotal evidence, John. I would totally agree with that.
Okay, I'm going to have to go back at Kendra and get her to remind me what the brain part is that she has in mind, but I'll share that with you.
Sure, I appreciate it.
In Q&A, we have another fresh question from Rebecca Jordan. This is a really sensitive point she's raising. Would you recommend pushing back against a clinic that seems to not want to react when levels are routinely in the 300s? I've been told that my child's levels are great when they come back at 359.
Yeah, you're right. It is a sensitive point. What I would say is you always want to be on the same page, and you want to feel supported by your clinic, and they're really there to help. And I could see, I could see where they may be coming from in a sense that, treatment range is considered 360 and below. And those ranges were set for a number of different reasons historically. But one of the things that it's going to be an individual choice for each family. Like, how do you balance the challenge and the difficulties with getting Phi really low to quality of life, right? It's always a balance between quality of life and where you are in that lower end of the Phi range. And so I think that's a personal choice with your family. If you feel that you and your child, I assume this is a child, doesn't say child, but you or your child, that you want to shoot for lower Phi levels, talk to the clinic as to why you want to do that, I would say, and say, I realize that, it's great that we're already in that range of treatment, but lower is better, even lower is better, and work with them on how they can support you in that decision. Again, I wouldn't say pushing back, but engage them, explain to them why you want to try and do this and see how they can support you in lowering them further, if that's something you'd like to shoot for.
And Rebecca, it's John here. If you want to have a conversation offline, I'm happy to do that as well in terms of both strategy and tactics, given, and I don't know which clinic you're talking about. So, and we'll keep that offline for the time being. But the other thing I wanted to say is that some people sometimes wonder where in that the current guidelines, the treatment range, the low end being 120, and we know that's still even a bit higher than in the non-affected non-PKU population. I think people don't know or have forgotten where the 120 level came from. And it's maybe lost in a bit of history, but originally the Guthrie bacterial inhibition assay from the blood test from the 1950s and 60s was not accurate below 120 micromoles per liter. So that became there was a limitation of the technology at the time. That particular assay is still in use in some places, but we have science and technology has advanced, and through tandem mass spectrometry in particular, we can get much more precise readings of Phi levels at the lower levels as well as higher levels. But it's just ironic. It's an artifact of technology limitations from the 1950s that 120 is there as the lower level. Thus endeth the history lesson. All right. And Francis Goodfellow says, thank you very much to Kelly for the answer. She can work with that. And Rebecca is also saying, thank you. We do love our dietitians and geneticists. They're very helpful. And they're clearly about their appreciate any and all support. And she's provided her email address, which I will make a note of. Thank you, Rebecca. Anyone else? Any final comments here?
I would like to thank you guys very much on behalf of CanPKU, but more so our adult PKUers who often feel unheard and they often express to us that the focus is always on the children. So I am very happy to be the one to thank you for ensuring that the focus is not lost on the adults.
Very welcome. We're happy to come back anytime. Thank you for inviting us. This is fun.
Okay, super. Thank you all, and thanks everybody. Shawn, you and your team are not going to be strangers to Canadians living with PKU. Take care. Keep up the good work.
All right. Thank you.
Bye-bye.
Guys. Take care.
Bye-bye.